If we are talking about infectious diseases that have grown rapid across the globe, we may pay attention to malaria, tuberculosis, HIV and AIDS, right? Then what if I tell you that there is this disease that in 2022 WHO reported that over 254 million people were infected with the chronic form, with a fatality rate of about 1.1 million people. You might be wondering, which disease is that, right? But before I tell you, look down and click on the subscription button to be getting my videos anytime they are being posted. This condition is the most common liver disease in the world, being called hepatitis B. Now, let's quickly go through the overview. What is hepatitis B? Hepatitis B is a life-threatening liver disease being caused by the hepatitis B virus, HBV. The hepatitis itself is a medical term known as inflammation of the liver. The HBV is a DNA virus that is capable of causing both the chronic and the acute form of the disease. The chronic form increases your risk of death, maybe from cirrhosis or liver cancers, whilst an acute phase, maybe lasting for less than 6 months, can resolve or maybe progress to the chronic form, which can be deadly. The primary way through which HBV can be transmitted is mother to child and sexual transmission, the use of contaminated needles, and infected bodily fluids like blood, saliva, seminal, menstrual, and vaginal fluids. What I simply mean is that you can get hepatitis B, from having an unprotected sex. Yes, I mean a sex without using a condom. It can be oral, anal, or vaginal sex. It can also happen to the child during birth mechanisms, and it can transfer from the mother to the child. Then we also get it from contaminated needles. It's more common with people who do inject drugs. It also happens in transfusing a blood that is not properly screened. Probably the donor is having hepatitis B, and I'm not saying you should not have sex or kiss, but then mind you, we've just said it can be transmitted via infected saliva, seminal, menstrual, and other vaginal fluids. It's possible, and a whole lot more. The good thing about hepatitis B is that the vast majority of people infected with hepatitis B, their immune system is able to kill the virus. So it's been in an acute phase, maybe resolved. But then the small minority goes down with the chronic form of the disease. The signs and symptoms of hepatitis B. People infected with hepatitis B can experience flu-like symptoms. They may also go down with fatigue. Abdominal pain is very common, and it often happens in the right hypochondriac region. I mean the right upper part of the abdomen. Nausea is also possible, and lots more. Then another clinical sign of hepatitis can be jaundice, and which we normally refer to as yellowing of the sclera of the eye and the skin. I know people may want to ask, how can you be tested of hepatitis B? Well, the only way you can be tested of hepatitis B is through blood test, and that is done in most of the health facilities. So I advise you visit the nearest health facility so you can be tested. A quick one on the treatment of hepatitis B. For acute viral hepatitis B, there is no specific treatment I can say, but then you only have to work to improve your nutritional balance and maybe maintaining fluid loss, like if you had vomiting. But for the chronic one, we can give oral antiviral medications. And what if you fail to take the medications? Or what if, your chronic form of hepatitis B is not being treated? Then you are likely to develop what we call liver cirrhosis, which is the hardening, thickening, we can say scarring of the liver. And some people can develop hepatocellular carcinoma, liver cancer, And what I actually want you to focus on in this whole video is the prevention aspect of hepatitis B. Well, to get yourself free from hepatitis B, you can start practicing a protective form of sex. Start using condoms. The condoms you're afraid of, start using them. And try to modify all the possible ways that hepatitis B can be transmitted. And at last, there is a vaccine available that provides about 98 to 100% effectiveness in preventing hepatitis B. There is a well-structured vaccination schedule on the under 5 card for children, but then for adults, the vaccine is being divided into 3 doses, given at the first dose is being given at your first day of visit, and the second dose is given 1 month later after your first dose, whilst the third dose is given after 6 months from your second dose. So visit your nearest health facility now and get vaccinated to be safe from hepatitis B. Thank you. Don't forget to hit the subscription button.